CCHT Practice Exam Dialysis Tech Study Guide and Review 25 Must Memorize Questions. Question 1. What is the primary purpose of the water treatment system in a dialysis clinic? To provide drinking water for patients. To remove toxins and contaminants from the water used for dialysate. To cool the dialysis machines. To clean the floors. Water treatment is critical to prevent patient exposure to harmful substances during dialysis. Question 2. Which of the following is a sign of a localized infection at an AV fistula site? Generalized fever, redness, warmth, and swelling at the site, low blood pressure, increased appetite. Localized signs include inflammation at the access point. Question 3. The term clearance in dialysis refers to how fast the patient can leave, the rate at which a solute is removed from the blood, the cleanliness of the clinic, the amount of fluid removed. Clearance, K, measures the efficiency of toxin removal. Question 4. What is a bruit? A visible pulse in the access, a buzzing or swooshing sound heard over the access, a hard lump in the access, the feeling of a vibration over the access. A bruit is the sound of blood flow heard with a stethoscope. Question 5. A patient's dry weight is defined as the weight when the patient is wearing heavy clothes, the target weight at the end of treatment without excess fluid, the weight before eating breakfast, the weight after drinking 2 liters of water. Dry weight is the ideal post-dialysis weight where the patient is normotensive and edema-free. Question 6. Which of the following can cause hemolysis, rupturing of red blood cells, during dialysis? Correct dialysate temperature, high dialysate temperature or kinks in the lines, low blood flow rate, using too much heparin. Excessive heat or mechanical trauma can break red blood cells. Question 7. The air detector on a dialysis machine is designed to prevent bacteria from entering the blood, air embolisms, fluid overload, high blood pressure. It stops the blood pump if air is detected in the venous line. Question 8. In standard precautions, which of the following should be worn for all dialysis procedures? Just gloves, gown, mask, and eye protection. Only a mask. Nothing if the patient looks healthy. Dialysis involves potential exposure to blood, requiring full PPE. Question 9. What is the main function of the dialysate solution? To provide vitamins to the patient, to create a concentration gradient to pull toxins from the blood, to keep the blood from clotting, to measure the patient's blood pressure. Dialysate helps remove waste products via diffusion. Question 10. A thrill in a fistula or graft is a sound heard with a stethoscope, a vibration felt with the fingertips, a sharp pain, a cold sensation. A thrill is the tactile vibration of blood flow through the access. Question 11. Which electrolyte is most commonly monitored and restricted in dialysis patients? Sodium, potassium, calcium, magnesium. High potassium, hyperkalemia, can cause dangerous heart arrhythmias. Question 12. What is the purpose of priming the extracorporeal circuit? To warm the machine, to remove air and sterilants from the dialyzer and lines, to test the patient's blood, to save time. Priming with saline ensures the circuit is safe for the patient. Question 13. Which of the following is a common complication of rapid fluid removal during dialysis? Hypertension, hypotension, fever, hyperglycemia. Removing fluid too quickly can lead to a drop in blood pressure, hypotension. Question 14. The movement of fluid through a semi-permeable membrane due to pressure is called diffusion, osmosis, ultrafiltration, convection. Ultrafiltration is pressure-driven fluid removal. Question 15. What is the minimum recommended hand hygiene time using soap and water? 5 seconds, 10 seconds, 20 seconds, 60 seconds. 20 seconds is the CDC and clinical standard for effective hand washing. Question 16. Which medication is commonly used during dialysis to prevent blood clotting in the circuit? Aspirin, heparin, warfarin, insulin. Heparin is the standard anticoagulant used in the dialysis circuit. Question 17. Steal syndrome occurs when the patient steals supplies. The access steals too much blood flow from the extremity distal to it. The machine breaks down. The nurse misses a treatment. It results in ischemia, lack of blood flow, to the hand or foot. Question 18. What does the K in KT/V represent? Time, volume of water, clearance of urea, potassium level. KT/V is a formula for dialysis adequacy. K is clearance. Question 19. Which part of the water treatment system removes chlorine and chloramines? Water softener, carbon tanks, reverse osmosis, RO, machine, sediment filter. Carbon tanks are specifically for removing chlorine/chloramines which can cause hemolysis. Question 20. If a patient develops a fever and chills during treatment, what should be suspected? Fluid overload, pyrogen reaction or infection, low blood sugar, allergic reaction to food. Sudden fever/chills often indicates contaminated dialysate or an infection.